Pertama minta maaf dulu karena yang tadi agak terhambat. Semoga yang ini enggak. Kita pindah ke provider yang lebih baik. Gitu. Jadi hari ini kita bersama Nick Veldwijk.
Pagi, yeah, perfect.
Nick Veldwijk from Mainline. Mainline adalah sebuah organisasi di Belanda. Maybe you can explain better than me. What is Mainline and what are they doing in this work?
So Mainline is a harm reduction organization focusing on the health, kesehatan, and rights hak for people who use drugs, both nationally as internationally.
Okay. So what are the regions or countries that Mainline involved in? Besides the Netherlands?
Yeah, African countries and Asian countries. So Asia focus on Pakistan, Nepal, Vietnam, Indonesia. We're here right now.
Jadi salah satu dari negara-negara di Asia yang juga menjadi fokus Mainline, Pakistan, Nepal, dan Vietnam dan Indonesia. Di Indonesia Mainline juga tidak sendirian, ada partner-partner kerjaan juga. Di antara ada kita, LBH Masyarakat, ada PKNI juga, ada Atmajaya, betul ya, ada Karisma dan ada PKN Makassar nantinya. Jadi menyenangkan sekali punya Nick di sini dan kita akan bicara banyak juga. Beberapa hal akan kita bicarakan di siang hari ini, antara lain adalah tentang harm reduction itu sendiri. Jadi apa aja, what are the things that Mainline do in terms of harm reduction, especially maybe the innovative ones. Yeah, both in Asian countries and African countries. Yeah.
So in every country, you would like to improve harm reduction through working together with local organizations. So we do outreach, we do needle syringe programs, we do opioid substitution therapies linking to health service, HIV testing, but also psychosocial issues. So one example of innovation in Pakistan, what we're doing is setting up a pilot on mobile HIV testing, where there's a lack of access to HIV testing, but also ARVs provision. We have set up biometric databases to improve the programming. We can directly see what are the needs of the user, what kind of services does this person needs.
By their fingerprint.
By the index finger. So it's completely privacy. So no names.
Jadi ada beberapa hal inovatif yang dilakukan oleh Mainline. Tadi Nick cerita sedikit tentang yang ada yang di Pakistan. Salah satunya adalah dengan mobile HIV, terus monitoring ARV supervision, dan kemudian biometric teknologi. Jadi ketika orang akses layanan, dia tinggal pakai sidik jari, terus datanya akan kelihatan semua, dan itu bagus buat pendataan ceritanya gitu. Kalau what are you doing in Indonesia? I mean, what are Mainline intervention in Indonesia for the last years?
Yeah, so in 2015 we started with the baseline investigation to see what are the real needs here in Indonesia concerning drug use. So we talk with different drug users, networks, community-led, community-based organizations, but also ministries. And we found out there's a real need on harm reduction programs for meth users. Crystal meth is really more coming up.
What are your program untuk jadi Nick bilang tadi soal memfokuskan diri untuk meth users, untuk teman-teman yang menggunakan sabu gitu. Nah, what are your intervention? Apa intervensi kalian for meth users?
So we are working together with Karisma. It's a local organization in Jakarta. We are providing harm reduction. So that means we are sharing services that shabu users need. But also we are linking to different health services. So we try to do the whole complete package. From outreach work, going into the fields, going to areas, meeting with the clients, asking what their needs are. If there are mental health issues or other health issues, we can link them up with.
I heard that you also disseminate things to while doing the outreach working. The outreach workers also disseminate what is the meds?
The lighters.
The lighters and the what is it?
The needles.
Not the needles. For shabu.
For smoking,
The
paper.
The foils.
True. So we also share that to the users because we think if you do it in a right, safe way. So use the right materials in order to prevent harm-related issues.
Jadi salah satu bentuk intervensi yang dilakukan oleh Mainline bersama teman-teman Yayasan Karisma adalah juga membagikan ilmu pengetahuan. Jadi ada semacam brosur begitu, terus kemudian ada korek apinya, dan ada juga foil yang bermanfaat untuk teman-teman pengguna sabu supaya dapat menggunakan sabunnya dengan baik dan tidak harmful kepada dirinya sendiri, begitu. Nah, what do you think is the biggest challenges to do harm reduction work here in Indonesia? In personal view.
That's a really good question. When we ask the outreach worker, for example, we see that mental health issues are quite common here.
Okay.
But at the same time, also maybe it's the Indonesian culture. Indonesian always laugh, right?
Yeah.
Everything is perfect. So it's really difficult to find the real problem. So what are you actually needing?
Okay.
So that needs time. So that means we need to set up a better client relationship.
Okay.
We need to talk a lot with the people. We have to earn their trust. And then if we have earned their trust, we can have a better communication of what the real needs are.
Jadi kalau kata Nick, salah satu hal yang paling penting itu sebenarnya mencari tahu kebutuhan klien. Dan mencari tahu kebutuhan klien itu bukan hal yang mudah, karena kalau menurut kita orang Indonesia itu lebih berlapis gitu. Kita lebih suka tertawa di luar, begitu menunjukkan yang senang-senang, tapi sebenarnya ada hal-hal di dalam yang mungkin lebih penting untuk diadres. Tidak hanya sekedar memberikan service atau layanan harm reduction gitu.
And one very important issue is also the policy. If you look at the criminalization of drug users in Indonesia, that is always a challenge.
Okay.
So we can talk about that later. From my experience from the Netherlands, how we deal with drug users.
Exactly. Jadi kalau kata Nick juga, dia bilang kriminalisasi itu salah satu hal yang menghalangi melakukan pekerjaan-pekerjaan harm reduction atau hal-hal yang terkait dengan layanan. Yang menarik kemudian sebenarnya gimana sih Belanda memandang kriminalisasi. Kalau what happened in the Netherlands itself? From what we know, Netherlands has harm reduction services, and Netherlands also have this coffee shop policy towards marijuana, towards cannabis. What happened that pushed those kind of policies, and what are the data now? As you may know.
So if I can say some key features of the Dutch drug policy, first is pragmatic.
It's pragmatic.
So, in the years of 70s, you had a lot of heroin users on the streets. There were no services. People just laying there, injecting, looking for money to buy them the heroin. So there were also often a lot involved in criminal activities. So
di tahun 70 banyak pengguna heroin dan kemudian yang juga akhirnya terlibat pada yang ini kemudian mendorong untuk layanan ya. Jadi pengguna heroin ini sibuk dengan dirinya sendiri, kemudian melakukan banyak tindak kriminal dan lain sebagainya. Pada saat itu ya.
So then Mainline started providing exchanging needles and syringes, providing health education.
At the 70s. In the 70s,
80s. So while there were no services, we started the drug users started doing themselves. So eventually, the government started acknowledging the facts and taking up health services, for example, needle exchange. But even in the 90s and in 2000s, had medical heroin provision.
So there's medical heroin in Netherlands as well. Cool.
So the difference between the policy in the Netherlands and Indonesia is that we are looking at it from a health-based perspective. We see that drug use has health issues, and we need to have interventions, activities that improve the health of drug users, not criminalize.
Jadi kalau kata Nick, hal yang paling membedakan antara Indonesia dan Belanda adalah melihat kebijakan narkotika dari kacamata kesehatan, health-based approach gitu. Dan hal-hal yang dilakukan antara lain untuk pengguna heroin misalnya ada soal medical heroin. Jadi kalau medical heroin ini supervised, artinya pemberian heroinnya they give the heroin in a supervised environment. There's doctor, nurses, and things like that. Hal yang serupa mungkin juga terjadi di misalnya Swiss sebagai pelopor. Ada hal lain. Is there anything related to that you can explain?
Well, the one other feature is we tolerate. So in the Netherlands, people think that we have two different types of policies. You have soft drugs. For example, hashish and cannabis, and you have hard drugs, cocaine, LSD, MDMA. So we think that the harm-related issues, so the health-related issues of soft drugs is less, so we have a different approach. We tolerate the use. It is a criminal offense, officially, but you don't get prosecuted.
So di Belanda mereka membedakan drugs jadi dua gitu, ada soft drugs sama hard drugs. Di soft drugs sih misalnya mereka mendapatkan hasis, ganja dan hal-hal yang sejenis. Kemudian di hard drugs ada kokain, LSD is also hard drugs. Ya. Ada kokain, LSD, heroin di hard drugsnya atau obat-obat yang keras. Dan mereka bilang salah satu fitur yang paling penting ada tadi selain health based approach adalah mentoleransi. Jadi penggunaan narkotika itu sesuatu yang bisa ditolerir dan oleh karena itu intervensinya akan berkaitan dengan itu. Kemudian what is happening with soft drugs and hard drugs? What different policy towards those things?
So, for example, if we have a lot of coffee shops, right? So you go into the coffee shops, you say, I want 1 gram of hashish or marijuana, you can get it. You can safely use it.
Okay.
Though it's illegal, so that means we tolerate it. We don't prosecute anybody while smoking marijuana.
Nobody?
No. No, only if you have an amount higher than 5 grams for cannabis, for example.
So, jadi pada dasarnya penguasaan cannabis itu tetap sesuatu criminal offense, tapi mereka mentolerir itu, mereka tidak memprosecute atau tidak menuntut orang karena penguasaan atau penggunaan ganja. Jadi kalau di Belanda itu ada sebuah kebijakan namanya coffee shop, orang bisa datang ke toko-toko tertentu dan di toko itu kemudian orang bisa beli ganja. Kalau tidak lebih dari 5 gram dan dibawa pulang, itu tidak akan ditangkap atau dituntut pidana. Gitu. So, but this policy of coffee shops, it's not like really full legalization as happens in the U.S. Not in the U.S. but in certain states of in the U.S. What's the difference between them?
So it is a gray area. Everybody thinks marijuana is legal, but it's not officially. So you can buy it. You can use it, but you cannot traffic it. You cannot manufacture it.
Okay.
So if I go to the coffee shop and I say, well, I would like to have marijuana, I will get it. But if you ask the coffee shop owner, where do you get your marijuana from? This person said, well, when I came in the store, it was there.
Okay.
So the back door is criminalized.
Okay. So, jadi ini memang sesuatu yang sering juga dibicara bahwa kebijakan Belanda itu backdoor policy. Jadi orang tuh bisa jual, tapi dia nggak boleh nanam, dia nggak boleh pabrikin ganjanya gitu. Jadi ketika misalnya kita tanya sama satu orang yang misalnya emang punya coffee shop, ketika ditanya dari mana kamu dapat ganjanya, dia akan bilang bahwa ketika saya masuk toko, ganjanya sudah ada di dalam toko saya dan itu yang saya jual. Jadi nggak di situ ada di belakang pintu si toko itu tindakan kriminal semua. Bagaimana ganjanya masuk ke Belanda, bagaimana ganja yang kemudian dibawa masuk ke toko, itu semua tindak pidana. Tapi ketika ada di dalam toko, bagaimana dia menjualnya dan segala macam, itu bukan tindak pidana, itu ditolerir oleh pemerintah Belanda. How does the government tolerate this? I mean, what kind of politics do they like shake hands with police, with the Ministry of Health, or how come that's come to this policy?
They don't offend it. They not prosecute it. So they have specific rules. So, for example, no nuisance. So no problems around the coffee shop. Do not sell people under age of 18 years.
Okay.
Do not sell hard drugs. So there are different regulations. They call it toleration criteria that coffee shops should have. So the last years there has been a new regulation that says the coffee shop cannot be in between 250 meters of any education facility.
Jadi ada beberapa peraturan juga. Misalnya tadi nggak boleh ada kekacauan di sekitar coffee shop, nggak boleh ada keributan di sekitar coffee shop. Terus ada juga yang terakhir, ada peraturan baru bahwa coffee shop tidak boleh berada 250 meters. Tidak boleh berada 250 meter dari education institution atau institusi pendidikan. Yang mana itu sangat baik karena keberadaannya kan semacam promosi gitu ya ke anak muda. And you cannot sell it as well to people under 18 years old. Dan kita tidak bisa juga menjual ganjanya ke orang-orang yang usianya di bawah 18 tahun. Dan itu sesuatu yang penting juga. So how does this policy in your personal opinion, of course, impact young people? Do they like interested in?
Well, if you look at the numbers, because there's more availability, it doesn't say that people are using more.
Okay.
For example, in France, it is illegal, but people use a lot more. In Sweden, it's a very strict policy, and people start less. So we can definitely say that the availability of drugs doesn't influence the use.
Itu salah satu hal yang patut the availability of drugs. Ketersediaan drugs itu nggak berbanding lurus dengan peningkatan pemakaian, dengan jumlah pemakaian. Ada hal-hal lain dan mungkin so if the availability of drugs doesn't mean that it will increase the use in a population. What do you think? What do you think? Things that will impact the numbers of using? Is it social norms? Is it social situation, or economic situation, or whatsoever? Or is a really there's too many factors to count in?
Yeah, I think that it's a lot of factors. But you can imagine if something is illegal, it's attractive, right, to take.
If something is illegal, that's more attractive for the young generation.
Yeah. So for me, I don't smoke because it's not attractive. I don't like the effect.
Okay. You don't smoke?
No.
Okay, cool.
I've done it.
but just not again. So dari si Nick bilang ada hal lain yang patut diperhitungkan adalah bahwa ketika sesuatu ilegal dia lebih menarik gitu ya. Temen gue juga pernah bilang kayak gitu, ketika misalnya sesuatu ini jadi legal, dia jadi nggak seru lagi. Jadi itu mungkin sesuatu yang patut dipikirkan juga oleh pemerintah atau parlemen, apalagi mengingat RKUHP masih memasukkan narkotika ke dalam. So, is there, in your personal opinion as well, is there any bad impact bad impact of the coffee shop policy or this backdoor policy?
Yes.
And how should the Dutch government comprehend with this situation?
Yeah. So the problem is the backdoor policy. So you don't know where your marijuana is coming from. You don't know what the quality is. Some people say, well, the quality decreased. So in my opinion, I think you should somehow regulate it. I don't know what way, but I think by regulation you can ensure the quality, the availability, and also you can reduce the harmful effects of drug use. That includes criminalization and marginalization of different groups. Right now they are working on regulations of cannabis. So this new regulation has been approved by the second chamber, and I think it needs to be approved by the first
chamber before it became law. It became a law.
Yeah.
So ada masalah di backdoor policy ini. Jadi karena kita nggak tahu ganjanya datang dari mana. We don't know where it's come from and how is the quality, bagaimana kualitasnya. Dan oleh karena itu Nick suggest, dan bagaimana banyak orang juga sebenarnya suggesting, menyarankan bahwa sebaiknya backdoor policy ini dilengkapi saja dengan bahwa orang-orang bisa maybe have a license to plant their own marijuana.
Yeah, you already can. But well, yeah, you can
for the industry, for the regional industry. Yeah.
So well, it can save a lot of economic benefits for the government as well.
Yeah, and then punya tanaman sendiri, bisa dipabrikasi sendiri, bisa dimanufakturkan sendiri, bisa di package dan lain-lain sendiri. Dan oleh karena itu hal ini sebenarnya juga udah masuk ke second chamber-nya DPR-nya Belanda dan nunggu persetujuan atau vote-nya first chamber-nya parlemen Belanda supaya ini nanti bisa digolin menjadi hukum, sehingga kemudian nggak ada lagi tuh backdoor policy. Tapi so there will, if this law continues, if this bill continue to be passed as a law, there will no backdoor policy.
No, they are piloting now what is the best option. So that means maybe the government will own it completely, or there will be different organizations responsible for the quality.
So there will be, akan ada salah satu badan gitu yang bertanggung jawab untuk kualitas, for the quality of untuk ganjanya. So so we're moving on with the hard drugs. And with the hard drugs, we of course have to talk about harm reduction at this point. So what are harm reduction services that now are existing in the Netherlands?
Well, that is an interesting thing because we don't have a lot of heroin users anymore because of the good harm reduction services. So what we have done, we're providing needles and syringes. So clean needles, syringes reduce the chance of transmission of HIV if you share needles.
But it's not like for heroin users only now. It's
also for smoking. If you want to smoke crack, cocaine, heroin, whatever, their service. So maybe you've heard of drug consumption rooms.
DCR,
yeah. So there's a room, a house, a rumah, where you can just enter and you get the services. There are health professionals also available to answer questions, to support you. So it's completely a really safe environment to use drugs.
Okay. Does this DCR also come hand with the medical heroin, or is it two separate places?
There are drug consumption rooms, and there's a place where you can get medical heroin. So there are more drug consumption rooms. So it's not always the same.
Okay. There's some place with the DCR is together with the medical heroin, but there's also place where the DCR only, and the medical heroin is separate.
For Dutch people, but also for international people.
International people. Yeah. So like we should can we bring passports only, or we should register?
No, for example, I was in a drug consumption lately, and I was sitting there together with my colleagues to provide also health education to support people. So there were a couple of Italians coming in and started smoking heroin. One started injecting. Okay. So they could easily come in without identification. They can have a coffee. They can sit.
Without any identification. No. Wow, that's cool. Jadi DCR ini ternyata nggak cuma buat orang Belanda doang, internasional juga boleh gitu. Apa sih bahasanya WNA? Tadi Nick cerita bahwa dia waktu sedang bekerja di salah satu DCR, drug consumption room, ada orang Italia datang, terus heroinnya di-drag gitu ya. Terus itu sesuatu yang memungkinkan untuk WNA di sana. Apakah kemudian is this policy, the DCR that open for a lot of people, including international, including for foreigners, and coffee shops, which is also open for foreigners? Yeah. Is this situation came up with, I don't know, bad perspective from the public, or towards it? It is controversy from the public because they don't like foreigners or things like that.
Well, maybe change is always difficult. So it needs acceptance. But nowadays, every Dutch person, we accept it. It's there. Okay. Well, a lot of Dutch people do not smoke marijuana. I don't know the numbers, but maybe because it's normal for us, we have accepted it. We see the added value. Okay. We are proud of it. Yeah, we have had a very progressive harm reduction perspective. We always had. There are some challenges. There are several ways to improve it. For example, Portugal, if decriminalization of hard drugs as well, really focusing on the health perspective from the drug users, not criminalizing them. That is something we can pursue as well. So this is a challenge or a next step that we should take.
Jadi Nick juga bilang bahwa hendaknya juga Belanda juga meniru Portugal yang memang mendekriminalisasi pengguna narkotika secara keseluruhan begitu. So needle exchange program, DCR,
methadone, buprenorphine.
Of course, methadone, buprenorphine. Medical heroin. Medical heroin is different from methadone and buprenorphine, right?
Yeah.
It's clean and clear heroin. So consult with the doctors.
So what you get with heroin is when
we don't know.
It's a high. And then the effect is very short. But it's really, really nice. So you need to have more. Okay. That's the reason people start taking more. The methadone and the buprenorphine it's a little bit. It's also uplift. Yeah. So the effect of methadone is less high, but for a longer time. So that means you can function normally. You don't have to crave for another shot of heroin, or you don't need to get forced in criminal activities in order to get money. So you can get a job, you can do lead a normal daily life.
Yeah, that's the benefit of methadone.
Yes. And one good thing to mention is that it saves a lot of money and it saves a lot of health issues.
And these people are also productive in the society as well.
Yeah, they have jobs. Yeah. So the next issue is. I think there are around 25,000 heroin users in Denmark. We don't have younger heroin users. Okay. It's a little bit of a taboo here, injecting heroin. Okay. There's a lot of availability of other kinds of drugs. So the young people, they're not really engaged with heroin anymore.
So is there any? So the drugs that are popular now, I don't know with Netherlands, the drugs that are popular now in Indonesia, I think it's more kind of like party drugs, like ketamine, like ecstasy, MDMA, like shabu, for example. And is this happening as well in the Netherlands?
Yeah.
what do you think is the best approach to this kind of drugs?
Ada drugs banyak. So yeah, well, I think ecstasy is produced a lot in the Netherlands, so the prices are very low. We have new psychoactive substances, so they change the molecular structure, so that's not officially on the opium list, so that's legal.
Pseudo legal.
Yeah. So GHB is also GHB ketamine in the party scene. So what we also see is the rise of crystal meth use in a sexual setting, especially among men who have sex with men.
Okay. So among MSM, the use of the crystal meth is rising up as well.
Yeah. It's the prices are getting lower. People start having like psychosocial issues because of the use of drugs.
And what do you think the best approach to party drugs? I mean, they use it in private settings. They use it in public settings as well, and in festivals. I heard there are a lot of interventions such as drug testing and so on.
Yeah.
So is it what do you think? Is it important? Is it helpful to have those kinds of interventions?
Definitely. I think one important of toleration policy, of harm reduction policy, is proper education.
Okay.
Yeah. So mainline is focusing on problematic users.
Okay.
So not on recreational users who do it often. So the problematic users are people who have psychosocial issues or health issues because of the use of drugs in a problematic way.
Okay.
What I think for recreational users is testing, for example. If I have an ecstasy pill or I have cocaine or whatever substance, I can go to the health service
and
to test. The amount of MDMA in an ecstasy pill, for example.
Okay. Yeah. Do you think it will be wider available in the future?
That's difficult to say.
I mean, don't talk about the nation. Just talk about it.
Yeah.
About the situation in the Netherlands.
My personal view is there's still a lot of emotionally based non-acceptance among the general population.
Okay.
If you are using ecstasy, you're a junkie. So that's quite stigmatizing. Well, I think we should all look at the facts and see that 80% of, for example, festival users is using drugs. So
we cannot close our eyes.
No, we think, well, drugs, you cannot. It's a utopia to not use drugs. So also the war on drugs, it costs us a lot of money.
Okay.
And what has been the effect? I think using harm reduction, so reduce the harms of using drugs. Is more effective and it's scientifically proven. So
kalau kata Nick, kita nggak boleh tutup mata bahwa drugs itu part dari kehidupan, ada bagian dari kehidupan, dan kita harus mentoleransi itu. Maksudnya mentoleransi keadaan itu adalah keadaan yang kita nggak bisa serta-merta hiraukan gitu. Dan oleh karena itu kita harus melakukan sesuatu terhadapnya. As final questions maybe. What do you hope from governments around the world? In Asia, particularly as a region that you work closely with, what do you hope from the government and to perceive drugs? How they should relate to drugs in terms to protect its own people?
So on the long run, it is a challenge for many governments. I would say look at the data, look at the evidence available on how to get along with drug use, rather than focusing on criminalization. Should focus on harm reduction approaches that really focus on the health of drug users and the rights of drug users, rather than marginalize them. If you use drugs, just throw them in jail. It is not any sense. It doesn't make any sense. Prisons will be fuller.
Okay.
And for what? For only smoking marijuana or whatever? I think it's not worth it. It costs you a lot of money.
Okay.
So economically, social, and looking at harm, human rights, harm and health, it's better to look at other approaches such as harm reduction.
Okay. So terima kasih banyak Nick sudah
sama-sama
sudah berada di sini. Jadi kata Nick terakhir bahwa hendaknya pemerintah itu lebih fokuskan diri pada pendekatan pengurangan dampak buruk dan kesehatan daripada pemenjaraan. Karena pemenjaraan lagi-lagi hanya memberikan kita ongkos berlebih untuk menegakkan hukum. Pemenjaraan tidak perlu masa depan seseorang, dan oleh karenanya lebih baik fokus kepada pendekatan kesehatan. Terima kasih lagi untuk Nick sudah ada di LBH Masyarakat. Thank you for Nick once again for being here. Terima kasih, tepuk tangan dulu. Weekend dulu dari kita, sampai ketemu lagi because everyone matters, itu ininya LBH Masyarakat. Thank you, sampai ketemu lagi teman-teman. Dah.